Good afternoon. My name is Frank Drew, and this is class NSP3885 under Professor Lily Bell. And the topic I am going to be discussing today is accreditation to promote quality and safety in healthcare. A quality issue that has become almost entirely universal among all healthcare organizations across the globe is that of improving patient health outcomes. With the ever-changing landscape of healthcare and its myriad of ways to provide health services that ultimately increase the longevity and quality of human life, healthcare organizations have made it paramount to devote scarce resources to improving every aspect of the patient experience. In doing so, many have undertaken the task of becoming an accredited organization with the Joint Commission, or TJC. The Joint Commission is a non-profit organization which accredits medical services and organizations around the world and routinely acts as an external quality assessment tool of an organization's strategic goals against acceptable standards in the industry. Brubeck et al. 2015. Additionally, there are several ways to implement change management to improve the overall quality and care in an organization. The following information will shed light on the perception of accreditation in healthcare and how accreditation and other continual improvement methods can affect significantly positive changes in safety and quality processes. The literature on the validity of accreditation seems to show little empirical evidence of the impact such accreditation programs have had on patient outcomes with regards to core measures and organizational culture. Brubeck et al. 2015. But nonetheless, more important indicators of organizational success is based largely on patient mortality, morbidity, organizational safety, and process outcomes. Brubeck et al. 2015. Additionally, two schools of thought seem to exist on the matter of its purpose. One suggests that quality improvement is incorporated through incentivized standards, which encourages organizations to achieve high-quality outcomes, whereby such standards are often revised upon evidence-based science, ultimately benefiting the patients with standards on an emphasis of innovation and utility. The other school of thought has been highly skeptical of its usefulness and the impact on quality due to study limitations. Stakeholders often discuss possible alternatives to accreditation altogether. A research study conducted in Serbia on the impact of accreditation on healthcare quality in hospitals makes the case that quality of healthcare is the most important characteristic of the healthcare system. Markovic, Petrovic, et al. 2018. In adopting programs from a 2010 rulebook on quality indicators, it served as a guiding framework for organizational change and innovation. Markovic, Petrovic, et al. 2018. The rulebook states that all healthcare institutions are required to collect data and calculate quality indicators, essentially to forecast a report by set deadlines pertaining to success, progress, or failure of new strategic goals and internal processes. The type of study conducted by the researchers was a quasi-experimental study that compared the differences between two sets of chronologically collected data, assessing differences in quality between institutions for a monitored period of time, and an assessment of the trends of variation for certain values of selected quality indicators. Markovic, Petrovic, et al. 2018. The study also assessed the direct impact of accreditation-related activities on quality indicators between institutions. Markovic, Petrovic, et al. 2018. The following health indicators were observed for the duration of the research study: the percent on total mortality rate, the percent on mortality rate within the first 48 hours of hospitalization, and the average length of waiting for the first scheduled health check at the institution in days, the average rate of hospitals days per patient, and the rate of days per patients with acute myocardial infarction. Markovic, Petrovic, et al. 2018. The results show that between 2010 and 2015, there were significant declines in many of the quality indicators being assessed at all the institutions in the study. Markovic, Petrovic, et al. 2018. The differences in difference, or DID analysis of these institutions convey The conclusions that accreditation-related activities and continual improvement processes had a significantly positive impact on health outcomes. Furthermore, the results from the study can strengthen the argument for accreditation in healthcare organizations. The author and researchers involved in this study express an urgency to change the way accreditation is perceived in healthcare. They feel that they can eliminate the notion that more evidence is needed by eliminating sensitive and discriminatory health indicators and instead replacing them with ones that focus on measuring the benefits of accreditation. Markovich, Petrovic, et al., 2018. A YouTube video of the Law Medicine Center at Case Western Reserve University School of Law addresses the ongoing concern of accreditation being quote-unquote of routine safety processes that fail rather routinely. Case Western Reserve University School of Law, 2012. President and CEO of the Joint Commission, Mark R. Chassin, stated in his lecture entitled Improving the Quality of Healthcare, where Law, Accreditation, and Professionalism Collide, that their main objective is to continuously update evidence-based safety and quality standards while simultaneously continuing to develop and deploy the most effective methods for on-site evaluation. He continues by adding that the Joint Commission is, if anything, an improvement organization that continuously creates and disseminates interventions to solve quality problems. Case Western Reserve University School of Law, 2012. Accreditation often sets extremely high standards, and those standards are difficult to uphold. The following information will discuss two actionable methods organizations can take to ensure continual improvement efforts do not fail. The textbook reveals a strategy in which organizations can integrate change management via continual improvement methods like Six Sigma. Simply maintaining the status quo does not suffice in terms of success in the global marketplace. Goish and Davis, 2016, page 326. Rather, it signifies an even greater need for continual improvement efforts. The concept of Six Sigma was derived from the understanding of statistical standard deviation and the variation of processes and their outputs, ultimately measured by the number of standard deviations away from the mean, or average, on a normal distribution curve. The goal for Six Sigma change is to mitigate variation in processes to produce an elevated and standardized repeatable output. This can be achieved through 5 phases: define, measure, analyze, improve, and control, or commonly called DMAIC. Goish and Davis, 2016, page 324. These phases allow for problematic processes and key process output variables and input variables to be defined. The development of measurement systems to be integrated, measured, and analyzed, yielding a reduced list of potentially critical key inputs, determining specific wasteful processes, and for the finalization of a control system and its long-term capabilities. Goish and Davis, 2016, page 342. Moreover, this DMAIC roadmap enables an organization to move forward with a long-term improvement effort with identified continual improvement opportunities and sound statistical data to ensure processes are operating within the parameters of the distribution. All focus is set on measuring what an organization does and then improving on what is already being done. A total quality process that can help to reduce the routine failures of these processes quickly to maintain high standards is benchmarking. It is a process where two organizations consent to share information regarding their processes and internal operations, with an expected gain of wealth and knowledge. Information which any of these two organizations consider proprietary is withheld. Goish and Davis, 2016, page 352. The two organizations then compare and measure the internal processes against industry-leading best-in-class processes. Goish and Davis, 2016, page 352. It is a process that involves several prerequisites before it can be implemented, including a commitment from management, proper funding, human resources, and the appropriate level of disclosure. Goish and Davis, 2016, page 356. Furthermore, it involves a total of 14 critical steps that satisfy the 3 phases of benchmarking. These phases include preparation, execution, and post-execution. Goish and Davis, page 360, 2016. The preparation phase includes a commitment from C-suite level of management and authorization to allocate resources to benchmarking efforts. It also requires key members to conduct a thorough review of its own processes, namely, creating a benchmarking list of the weakest and strongest processes which both inhibit and promote the competitiveness of the organization in the industry. Goish and Davis, 2016, page 360. The execution process involves benchmarking processes which need the most improvement against best-in-class processes, utilizing a benchmarking team and process operators with the intent to surpass a zero gap. Goish and Davis, 2016, page 360. The post-execution process involves monitoring new processes and the changes made to the processes needing most improvement. Goish and Davis, 2016, page 360. In recent news, Pruitt Health has embarked on its mission to obtain the Gold Seal of Approval by the TJC, considering their 50-year history of innovation in long-term care and servicing communities in the Southeast United States. They have more than 91 skilled nursing facilities and want to elevate their level of care through standardization and have an impetus on process and organizational functions imperative to providing safe, quality patient care. The Joint Commission, 2021. Their goal is to utilize TJC accreditation programs to both demonstrate their commitment to healthcare in the communities that they serve and to identify new known and unknown risks and potentially quality indicators affecting health outcomes. The Joint Commission, 2021. In conclusion, although the literature and empirical data on accreditation is brief, the implications for managers and healthcare organizations are very important. Throughout my research, a common theme among all my source points to the benefits of having stringent standards in place with the patient as the beneficiary to all the medical achievements and advancements we have made. Prolonged life through the innovation of healthcare is one of the reasons for why we are out of the dark ages. The light shed on disease through epidemiology should be no different than the importance we place on the quality and safety of healthcare. With this, I believe that the only way to move forward is to continuously want to improve and elevate healthcare. Accreditation is one of the greatest means of making that possible. I would highly recommend any healthcare organization to reach out to the Joint Commission and take the next step in quality elevation through their accreditation-related activities and programs and/or giving serious thought to Six Sigma and benchmarking continual improvement efforts. Thank you very much for your time.